Hello, my name is Abby Marsh, and this is my project titled Parent Technoference and Child Internalizing and Externalizing Problems, a systematic review and meta-analysis. This research was done by the Determinants of Child Development Lab here at the University of Calgary. Imagine you're a psychologist and a parent comes to you worried about their child's aggression. You might ask them about school stress, peer stress, maybe even the child's screen time. But would you ask about how often the parent checks their phone during family time? What I'm referring to here is called technoference, which is the interference of digital devices in face to face interactions between family members. We might see this when a parent is checking their phone during playtime, or a family meal, or maybe a notification interrupts a conversation between parent and child. What we see is that nearly 90% of parents engage in technoference at least once a day, and that the effects of this actually persist over time. And the past decade has seen growing research that even seemingly normal amounts of parent technoference affects child mental health, potentially even long term. However, right now, findings between individual studies vary across samples, ages, and contexts. So, we employed a systematic synthesis to understand the true impacts of these effects across development. This leads me into our research question. Firstly, we wanted to see what the association was between parent technoference and child internalizing problems, which are things like anxiety, depression, or withdrawal. And then our second research question asked, what is the association between parent technoference and child externalizing problems? Or rather, things like aggression, bullying, or substance use. We also examined several moderators to see if these effects varied by developmental, geographic, or methodological factors. For those of you who are not familiar with what a meta-analysis is, we statistically combine the results from multiple independent studies surrounding parent technoference and child internalizing and externalizing problems to come to an overall effect size, or essentially a conclusion about what the literature is saying right now. We systematically searched several databases, which resulted in approximately 4,100 non duplicate articles published between 2017 and 2025. Of those articles, 49 met our final inclusion criteria, which resulted in nearly 53,000 participants being included. So, what did we find? Preliminary analyses revealed significant positive associations between parent technoference and child internalizing and externalizing symptoms. But what about the moderators that we looked at? Significant moderators that we found included the outcome subtype, with aggression, bullying, and general externalizing concerns being significant. Study design was also significant for internalizing studies, with longitudinal designs showing significantly smaller effects than cross-sectional designs. So, unlike many risk factors that we traditionally study in our lab, technoference is entirely modifiable. It's hard to change things like a family's income or a child's temperament, but we can change how devices are used during family time. This research suggests that something as simple as putting phones down during parent child interactions could be one of the most accessible mental health interventions available to families. Back to the parent who's worried about their child's behavior. It might be a good idea to start asking parents about their screen time. Thank you for watching my presentation. This project was co-authored by Dr. Sherry Madigan and Rachel Eyrich.